Hi. Hi,
Hi.
everyone.
Hi, how are you
It's
doing,
so good
doctor?
to be here today. Dr. Afolabi-Brown, the founder of the Restful Sleep Place and Restful Sleep MD. Let's just make sure we're on Instagram. There we go. So we're really excited today. We're going to be doing something a little bit different. You guys hear about sometimes I talk about the fact that I'm not too excited about the term sleep hygiene, right? And my dear friend here, Dr. Valerie Mukanga, is going to be talking to us about dental hygiene. So, we're going to be talking about dental hygiene and sleep hygiene and how these things are just so important, yet they're not necessarily the fix for, um, underlying issues when you have either, an oral health issue or a cavity, right? Or if you have a condition like insomnia or sleep apnea, like there's no amount of sleep hygiene that's going to fix an underlying sleep issue, right?
Right.
Similarly, there's no amount of dental hygiene that's going to fix a cavity. Am I wrong? So I just wanted to put that out there. That being said, I think it is important that we address the basics. And so we're going to be, maybe if you will, doing a little bit of compare and contrast today. And so for our listeners, Dr. Valerie, it is so good to have you here. I'm
Thank you
really
so much.
excited. Yeah, can you please introduce yourself to our friends?
So, I'm Dr. Valerie Mukanga. I own a dental practice in Arlington, Texas, which is in the DFW area. And what we do in our office is everything dental. I'm a general dentist. So, we see patients of any age, from babies to adults, you name it, we see it. And we call this place the place where we help our patient regain or maintain their oral hygiene and smile so that they can soar in life.
Oh, I love that. Smile so that you can soar in life. That's awesome. So maybe let's get started with just that term, dental hygiene. What really is it?
Well, dental hygiene is everything that you need to do in order to make sure that your hygiene is pristine. So, it goes from everything that you do at the dentist, but also what you have to do at home. And so, how do you take care of your teeth so that your oral hygiene is healthy, or leads you to have a healthy smile, healthy teeth, healthy gum, healthy anything that has to do with the oral cavity. That's in summary what dental hygiene is. And so, talking about that, there are some habits that we encourage our patients to have. One of them is to make sure that you brush your teeth really, really good. What does that mean? Because many people just brush the surfaces of the teeth themselves, completely ignoring, the surfaces between the gum and the teeth, when that is very, very important, because you have debris that get lodged between your gum. When that happens, it can lead to infection, inflammation of your gum tissue, and you're not really brushing well. So that's how, when many people come to the office and they think they're going to cheat, or they're going to, we're going to be thinking that they're doing a very good job at brushing. So you look at their teeth and they're squeaky clean, but once you kind of pass the probe through the gum, it's bleeding. And so
Oh,
you're not doing a very good job at home.
yeah.
So you can hide, but not so much really. We are the dental police. We're able to see whether you're doing a good job or not. So that's when it comes to, brushing. That's part of your dental hygiene. Another thing that you want to do is make sure that you do floss your teeth really good, because even though the bristles of the toothbrush look so tiny, they're too big to fit between the grooves of your teeth, the spaces between different teeth or the adjacent teeth. So basically, if you're not flossing, you are not able to remove those particles, food particles, even bacteria that gets lodged between those areas, and you can still, end up having poor hygiene, and also other problem that arise from that. And another thing that has to do with dental hygiene, that's what you can do at home. Of course, you can use, mouthwash. Of course, you can use all of those things, but you also don't want to neglect coming to the dentist at least twice a year if you have a healthy mouth, so that you can actually have everything put back into perspective and in check.
Mm-hmm. So, one of the things you said was sort of the teeth can look pristine, right? And I'm going to be drawn because, this, a lot of my friends here are, are parents or actually, clients or audiences that are in walks of life where sleep is really a thing,
Mm-hmm.
or, either their kids are not sleeping well or they are not sleeping well. But I'm going to be pulling some analogies from what you're talking about. So you mentioned the fact that sometimes the teeth look pearly white
Mm-hmm.
and then you look beneath the surface and it doesn't look that good. So,
No.
why would that happen? Is it because they're just brushing the top and they're not flossing? Like, what's going on with that?
Okay, yeah. So what happens with that is that they're not brushing the right surfaces of. Well, you have to brush all the surfaces of the teeth, including the surfaces between your gum and your teeth, because when you eat, you have particles, food particles that get lodged between those areas, and so that's what you want to make sure that you are doing. That way, you're brushing really good, so that don't end up having areas of your teeth, especially those areas where problems can arise, also taken care of or cleaned. So I liken a tooth like an iceberg, right? In fact, it really is like an iceberg, because what we know about an iceberg is that, the top part that we see is so small compared to everything that's hiding underneath the sea. And it's exactly the same with our teeth. So the part of the teeth that we see are the crowns of the teeth, but then you have the roots. The root make up about two-thirds of that whole tooth. And so, in fact, that's why, some people might think that they lost a tooth, but when we do x-rays, we see that part of the roots is still there. And they're like, no, I already lost my tooth. Yes, but it's only the top part. There's a big part of that same tooth that's still lodged in there. So even though, like, there's some areas on the roots that you can't really reach because it's encased in bone, there's area under your gum that you need to reach and clean. And you can do that, with your toothbrush aimed properly, so that you can remove all those debris.
Mm,
Not removing those debris is going to lead you to start having gum disease. And there's different types of gum disease, mainly two. You would have gingivitis, which is when your gum are inflamed. And how does that look? What does that look like? Your gum are puffy. They kind of like rounded instead of being kind of like knife edged. They can also be red in color for people who have pink gum. But bleeding is like one of the things that that will tell you that you have gingivitis. Then
mm,
you can also have periodontitis, which is when you have started losing the supporting surface of your bone that support or that holds your teeth together. And that's all because we are not doing a very good job over time at brushing properly. And bacteria are going to migrate down those areas, causing problems.
mm. Wow, that's a whole lot of stuff right there. So, here's the thing. With sleep hygiene, one of the things that we talk about are just similar to what you said, dental hygiene. These are just healthy practices that, for lack of a better word, helps to keep our sleep pristine or helps to
Mhm,
optimize our sleep, right? But I want to take us back to some of the things you said,
mhm,
right?
mhm,
Brushing your teeth twice a day, making sure you're flossing, getting checkups with your dentist, right? With sleep hygiene, right? These healthy sleep practices, maintaining your sleep schedule, making sure your room is cool, making sure you have a bedtime routine, making sure you are not drinking too much caffeine or using devices before bed. That's all under that umbrella of sleep hygiene, right?
mhm.
And the reason
Yes.
why we're doing that, similar to dental hygiene, is to prevent progression or, your sleep suddenly kind of falling apart in that sense.
Right, right.
But that being said, there are some things that can still occur in spite of having a good sleep hygiene,
Uh-huh.
right?
Uh-huh.
Similar to what you're saying, there are things, even if you're someone who flosses and does all those things, there might be things that can occur even though you're practicing all those dental hygiene practices, right?
Correct.
And in that case, like you said, maybe there is, inflammation of the gums. For me, there is, or I don't know, a cavity. Let's do cavity, right?
Okay.
For me, it's more of like insomnia, right? I have people who like clockwork follow this like 10 checklist, analogous or, similar to, floss, brush, do all that. So they have this 10-step checklist, but they're still not able to sleep well. And so they try harder. They try harder to make sure they follow those rules even harder. They block out lights even more. They buy blackout shades. They
Mm-hmm.
get the room temperature super cold, but they're still not able to sleep well, right?
Mm-hmm. Mm-hmm.
And I'm sure you would probably say your patient who has this ginormous cavity is now flossing like it's going out of fashion, is brushing like it's going out of fashion. Can you explain why, in that case? I mean, it's still important. Of course, you still need to brush, but that's not necessarily going to fix the underlying issue.
Correct. So if you have already developed infection, let's say, that is cavity, or, even, pus forming, yeah, you may brush as much as you're going to brush, but the problem has already started and is progressing and it becomes chronic. So at that point, yes, we're not going to say, stop brushing, stop flossing, but you definitely want to take care of the problem.
Mm,
So that being said, there are some people who, for example, and they come and they have a cavity,
mm,
like you said. We're talking, taking the example of the cavity, and so they have a cavity, and they come because they couldn't sleep at night because of the pain. So now, because of that, we give them maybe antibiotic because say they are swollen
mm,
because of the infection that was created due to the cavity in question. So now we give them antibiotic because at that point, perhaps, if we do the treatment right away, they will not be able to get numb because the infection is actually going to dilute or neutralize the anesthesia that we are going to be using so that it masks the pain and we can do the treatment, perhaps, do a root canal or do an extraction, whatever we're going to do. So we give them antibiotics and they go home. They don't feel pain anymore because, the infection is somehow contained. But then we tell them, make sure that you come in a couple of days so that we can take care of the tooth. And they just decide, oh, I'm good now. So they go missing. And then another day they stroll down in the office and they're like, oh, it hurts again. The swelling, comes again. So
yeah.
that being said, once if it's the tooth itself that's infected, not just the structure around the tooth. So
Mm,
we have to address the issue. If we're going to fix the tooth, we have to fix the tooth. Now, if you
mm,
have to remove the tooth, you have to remove the culprit so that, the infection can in fact get removed. It is the tooth itself that's infected.
mm,
So that being said, like, with sleep hygiene, you have to really target what the actual problem is and
mhm,
remove it so that you don't end up, in the same chronic issue where the same tooth is going to flare up. You go
mm,
home with the antibiotic, you feel okay, and then some people, maybe like a couple weeks, couple months, couple years, you know, you have to be back, maybe in an emergency room or like, and it's so funny because these things always happen, often happen at night when there is
mm,
no office open. The
yeah.
emergency room, they may not have like a dental a wing where they can actually take care of you as, I mean, the tooth itself. So yeah, so there's some things that, even though like once a problem has risen, you have to attack that particular problem and fix it so that you don't end up being in the same position over and
Mhm.
over again.
Oh, I love that. So, it sounds like this. You use the antibiotics, end up easing, providing a little bit of comfort, easing the pain, decreasing the swelling a little bit. So it's almost like a bridge to the main treatment. So
Mhm.
with sleep, let's use insomnia, for instance, which is quite common, right? It
Yeah,
is a condition where people have a hard time falling asleep or staying asleep, right? Or they're
right.
waking up at a time that's undesirable, and it
Mhm.
leads to daytime effects. And so that analogy you're giving around using, antibiotics, it's almost like using the sleep aid. So you run to the pharmacy, because you've followed all the sleep hygiene tips and it's not working because you do have an underlying reason. You most likely do that maybe has not been addressed, right?
Mhm.
um, and then you take, you name it, melatonin, magnesium, you take, ZQuil, Benadryl, and it gives some relief temporarily. And then
Mhm.
what happens? You feel better. You
Right.
don't need to address what's going on. And
Right.
then it's always short lived because usually after about 2 weeks or so, people with chronic insomnia now have, oh my God, it's worse. The medicine is not working. And then, maybe they take a different type of sleep medicine. But the idea is addressing the root cause. And what is the root cause?
Exactly.
It might be, yeah, it might be stress, it might be anxiety, it might be an underlying medical condition. So really taking a deep dive into where is this coming from, and then looking for a more long-standing treatment. So for something like insomnia, that's usually we'll talk about cognitive behavioral therapy for insomnia, which is really addressing habits, thoughts, and behaviors, around your sleep, right? That's
Mhm.
negative, that's impacting your sleep negatively. Or it might be maybe sleep apnea. So your brain is waking up frequently and now you're staying up at night, or
Right.
restless leg syndrome. So looking for the root cause, addressing that rather than just using, I mean, the medicine, the over-the-counter medications, the sleep medications may serve as a bridge
Mhm.
until you get the right treatment. But that
Mhm.
doesn't mean that we ignore where this is coming from. And so it's interesting that you brought that up because I think they you can really actually compare them. That, yeah, of course, that doesn't mean you should now drink caffeine at midnight or, watch TV all night long or whatever. You're still
Right.
following those healthy practices,
Mhm.
but you are now doing it really as a fundamental, while you're really trying to address what the root cause is.
Right. That's right.
Yeah.
As we're
So
talking, I'm learning a lot too.
I love that. Me too. So now I think one thing I wanted us to pivot real quick. I mean, we're rounding up, but I think I love how we were able to make that comparison. Sleep hygiene is
Yes.
very important. Dental hygiene is very important. But when there are underlying sleep issues, those things may not necessarily fix it. So you continue to follow those healthy, dental practices, oral health practices. You continue to follow those, healthy, sleep practices while you're addressing what the root cause is.
Correct.
One thing I always see, and now maybe I'll take it to the kids here, is two things, even adults. I mean, there are two people I do not like to see much. No, no, nothing personal, okay? It's my dentist and my gynecologist. you know? So there's really that anxiety around, around seeing your dentist, right? You're like, oh my God, they're going to give me shots. They're going to say I'm screwing up. They'll tell me to come back. They'll put all kinds of things. So people have that. And I also noticed too that, especially with young kids, as part of their bedtime routine, parents always report that it is so challenging to get their kids to follow through with brushing their teeth. So think of your 2-year old or so, they hate brushing their teeth, they're fighting, and it's contributing to the chaos at bedtime. And then your older child that you would hope would be a little bit more independent is not doing a good job of cleaning their teeth. They're not flossing, or they just brush their teeth for like, 30 seconds and then they just hop right off. So
Right.
talk to us a little bit about, like, how do we minimize that anxiety, and then what other strategies can parents use in getting their kids to follow those, dental hygiene practices, especially around, because most of the time it's usually part of your bedtime routine. So how do we
Right.
optimize that for families?
Yeah, so I think for families, it should really begin with the parents understanding, that dental hygiene is not, it's very, very important for the overall, body.
Mm,
And I often, or almost always, every time I'm interviewed, I come to talk about my uncle. Like, that was an unfortunate situation that happened in our family. My mother's brother ended up having a cavity that got infected, And when he went to see a doctor, it was too late. In fact, the very day that he went to see a doctor, he ended up having a stroke and he passed away. And
Mm,
so that is, that's so crazy, right, doctor? It actually happens because there is a deep connection between oral health and the rest of your body. When if I told you, okay, that your mouth is part of your body, you would look at me crazy. But many times, we treat it as if it won't, like a problem that arises in your mouth is not capable of affecting other issues or areas of your body. So there's a tight connection between periodontal disease and diabetes, for example. There's issues, periodontal disease and dementia, for example, heart attack, endocarditis, stroke, and other issues like that. So if parents understand that it's not just a thing that should be skipped if it's too hard, but it
mm,
can actually affect the health of their kids, then they will be able to instill those values and those routine into their own kids. But what happens is that many people have undergone stress and anxiety over the years, taking care of their own teeth, maybe going to a dentist and they had maybe like a bad experience. And so all of a sudden they internalize that, the
mm,
anxiety. And so they also tend to, even if they don't verbalize it, but kids can pick up whenever a parent is scared or is anxious, and they feel that energy. So the parent themselves need to kind of like overcome those, and dentistry has gone a long way as well. So before, way back in the days, if you had a cavity, they would automatically remove the tooth. But now, or when they ended up developing material to fix teeth, maybe to do fillings and crowns and things like that. At some point, they didn't have anesthesia, but now you have anesthesia. You have nitrous oxide, which is, commonly called laughing gas, that's going to decrease the threshold of your anxiety, making you more relaxed, where you are able to undergo the treatment in a better fashion if you need treatment. That helps too, but also there are cases where you can even be undergoing treatment with being sedated. That's another option. So there's so many options that have evolved over the year to ease out anxiety. So parents need to find comfort and also understand that it not taking care of your teeth, not taking care of your mouth can affect the rest of your body.
mm.
So if they understand that now, because parents, a good parent really wants the best for their children.
Yeah.
So if they understand that, they would understand that, that's the best for their children.
Mm,
So now they're going to make sure that they do instill those bedtime routine as far as oral hygiene is concerned, and just make sure that they do the best they can. Obviously, if your child has maybe like autism or have some, the issues like that, it's going to be even more difficult. But perhaps you can do it maybe with your spouse, and you hold the child in a manner to be able to brush their teeth. And those are techniques that we use when with young kids, like 2 year olds or 1 year old. When we see them, I'll be with the mother and they're going to lay the baby on my lap and I'm going to do the cleaning. And I'll say, if it's difficult, I'll tell you, you can do that with your husband, or maybe like with another older child or someone that's in the house, so that you can at least brush those surfaces of your child's teeth. Another thing that parents can do when children are young, they can actually do perform the oral hygiene routine while the child is watching, because children love to mimic their parents. So if you're doing that together, and you can even play maybe like a favorite song, and you just make it like a game, so that the child can kind of like find it interesting and everything like that. For example, my nephew, when I go and visit, I show him cartoons of people maybe like, brushing their teeth. And so it becomes something that's more fun, versus, watching all these things where they're showing somebody like, over a chair trying to pull a tooth, things like that, that are more positive. And then for older people, for older kids, I'll say maybe like teenager, I often tell them, um, sometimes say it's a guy or it's a girl, it's a guy, and I said, you want to make sure that your breath is up the part. You want to make sure that your teeth are fine, because the teeth that you're not brushing, those are the teeth that you can end up losing. So if there's a tooth that you want to lose, just keep that one, okay? Because you can end up losing that one. But also, like, you don't want to be bullied by your friends, or you don't want your girlfriend to laugh at you, because some of those things, even though it's kind of stretching it, it's best to stretch something to kind of like make them want to be involved, versus not doing so and just letting them, or letting things fall apart. So
Yeah.
those are kind of like some advice that I would give a parent, and also some ways that I'd say that can be, you know some ways that these oral hygiene habits can be addressed and encouraged. Yeah.
Okay, so I love that. And I'm going to draw the analogy using that for sleep too. So think of sleep like, and I say this to a lot of parents too, who maybe the child has a lot of, is fighting bedtime, is fighting
Mhm.
following through with the routine. And this is what I see. Just like you said, you think about your mouth as part of your whole system. So we think about sleep as fundamental. The
Correct.
same way you would never, ever, ever drive off with your kid not being strapped in their car seat, right? You wouldn't say, oh, he's fighting the car seat, so maybe we don't need to use it today. No, you would, they might be kicking and screaming, but you get it because you would make sure that that is a priority. So when we start with that mindset, like setting my kid up for success,
Mhm.
starts with building a good foundation of sleep, because when they're sleeping well, then they develop appropriately, their brain is developing well, their physical health, their immune system is robust, they're learning all the things they need to learn, and they become better versions of themselves. So once you deal with that mindset, then the second piece, like you said, is role model it. Do it
Mhm.
together. Sing
Mhm.
a song. You can do a bedtime chart. You could do reward system. You can,
Mhm.
just try to get them to engage so that it's not this painful process.
Right.
And also, and that's mainly for the younger kids, for the older kids, finding something that they connect with, right? This, for when it comes to oral health, like you said, you want a good smile so that you could, talk to that girl or that guy, right? You don't want them to be put off by your bad breath. And so they can connect with that. And
Mhm.
similar to sleep in teenagers, I think of, what do you like to play? Do you like video games? Guess what? When you sleep well, your response time is faster. When you
Wow.
sleep well, you can, you could score more free throws on at basketball. When you sleep well, you
Mhm.
become a better leader. You're more efficient to get all those good grades if that's something that makes sense to them, right? So
Right.
connecting it with something in their life that they can
That
relate
they
to
know.
will help to promote that habit change. So I didn't see this conversation going this way, but I see there's so many similarities, and I think we could keep talking forever. But right now, I think we've learned so much. I have learned so much. I think, again, the takeaway is all these fundamentals are so critical. Address the root problem if there's an issue that comes up. Find ways to engage your child or yourself in a way to consistently follow through with these fundamentals. And yeah, I think this is definitely going to be a video where you guys need to save and come back to. I'm gonna watch it again. But can you tell us, where can we find you? People want to work with you, whether I know you have you create videos and content that people can also just watch and learn from as well.
Right. So, if somebody needs our services, I'm Dr. Valerie Mukanga, and our office, Healing Wings Dental, is located in the Dallas Fort Worth area. So, in Arlington, precisely at 4101 West Greenhouse Boulevard, Suite number 317. Our zip code is 76016. And they can also give us a call at 972-213-0202, or find us on social media, on the web, on our website, www.healingwingsdental.com. On social media, we are on Facebook, we are on Instagram, LinkedIn, YouTube. If they type Healing Wings Dental, things will pop up for them where they can learn even more information, and even information like these that we share together. So that's pretty much that. That's how they can find us. Yes.
Wonderful. You're everywhere. I love it. I love it. I know. So if you are out there and we've talked a lot about sleep hygiene, right? And you feel like you're at a point where you've done all the things, I mean, if you haven't, then start with that, start with the fundamentals. But if you're a point where you or your child is struggling with any type of sleep issues, whether it's a hard time sleeping, hard time falling asleep or staying asleep, whether it's snoring or sleep apnea, whether it is anything else that's related to sleep that's impacting your child or your ability, and you are located in Pennsylvania, New Jersey, or California, give us a call at the Restful Sleep Place. Our number is 256078297, or go straight to our website at therestfulsleepplace.com, and we'll be so happy to walk with you and support you on your sleep journey. Thank you so, so much, Dr. Valerie. This
Oh,
was such
thank
a
you for having me. I enjoyed it. I learned a lot.
good, good, good. All right, everyone. Until next time, I hope you rest well.